on the chat, it says Jenny Adams says hi. I don't know who Jenny is. Unless she's in the waiting room or something. Maybe she's in the waiting room.
Yep, I think we're going to get started. We'll all be on mute. We'll get started in just a minute, and then Greg, Erica, go ahead.
Good evening, everyone. Come on in. Thank you for joining us. Again, good evening, everyone. We want to thank you all for joining us on this webinar slash Facebook Live. Again, thank you, everyone, for joining us. This is a live conversation, and we're so happy that you all are joining us. We look forward to an informative discussion as we begin to look at vaccination, what it looks like, what it means, particularly for those of us who are in healthcare and in childcare. We are honored to be joined by leaders in public health who can help us begin to make sense of the effort to vaccinate everyone and what the vaccine means. And as we try to take on COVID, it's really important that we get as much information as possible. So we're about to get started in just another minute. Again, thank you everyone for joining us in this important conversation about COVID-19 and the vaccine for COVID-19. This is an incredibly important subject for home care, hospital, nursing home, and child care workers. And so we look forward to an important and informative discussion today with experts on public health. And so my name is Greg Kelly, and I am the president of SEIU Healthcare, Illinois, Indiana, Missouri, and Kansas. And I'm so happy that you all are joining us in this conversation today to talk about COVID-19 and the vaccine. We know that there have been lots and lots of questions raised as folks prepare to take the vaccine or are expressing their concerns about wanting to take it at all. But we wanted to have this discussion with experts on COVID, on public health, as well as on the vaccine. So again, thank you all for joining us. Now, I would start first by saying we did a survey with our members about the vaccine, and what you told us, we heard loud and clear. There's a lot of information out there, some of it factual, some of it not as factual, but you told us that you wanted to hear directly from healthcare and medical professionals about the vaccine. And so we are so happy to have with us public health experts who are going to talk to us a little bit about the vaccination. So the purpose of our webinar discussion today is to afford members to have an opportunity to learn about vaccination programs, address issues of concern, including safety, worker voice, the right to choose, paid time off, and the need for vaccination programs to be part of a more comprehensive approach to addressing threats, causes, and losses of this pandemic. And our hope is that this discussion will begin an ongoing conversation that centers the voices of workers and communities, especially Black and Brown workers and Black and Brown communities. We know that there are lots of issues and concerns about COVID, and we're going to ask our experts to give their opinion on all of this. And so to start us off, we are so incredibly fortunate to have with us Dr. Heather Prendergast, MD, medical doctor at the University of Illinois at Chicago. She's the Associate Dean of the College of Medicine. She has been practicing medicine well over 20 years now, and is considered an expert in public health. She's an emergency medicine physician by trade. She's a past president of the Illinois College of Emergency Physicians. She's done groundbreaking work on healthcare outcomes for Black and Brown communities, and has helped secure millions of dollars in funding to study healthcare disparities and other issues that impact all residents of our state and our city, but has a particular focus on communities of color. We are truly, truly blessed to have an expert of her stature agree to join us today and talk to us a little bit about what she knows about the vaccine. And, hopefully we'll begin a conversation that we'll have about learning more about what the vaccine means for all of us. So without further ado, I'd like to invite and welcome Dr. Heather Prendergast, MD, Associate Dean, University of Illinois College of Medicine. Thank you for joining us, Dr. Prendergast.
Thank you so much. Good evening, everyone. And Greg, thank you so much for that nice introduction. And as you mentioned, I wear many hats at the university, but my love and my passion is in the emergency department. As mentioned, I've been an ER doc for, I've been at the university in the ER for this is going on 24 years. And, that means a lot to me because, my passion, my love is are the issues that are most important to me are access to care, the underserved and the uninsured. And so, I feel very privileged to be in the emergency department. And I'm very grateful for the opportunity to come and just talk about this because, without a doubt, these are some unprecedented and challenging times. The COVID-19 pandemic is unlike anything that we've experienced before. Yet as healthcare providers, essential workers in various roles, your sacrifices and contributions have been really the key to fighting against this horrible disease. You do it because you care. I do it because I care. We're all on the same team, and that's awesome. And I think, there's a lot, we're really at a crossroad right now. And, we now have the tools to help us really fight more effectively against this disease. I know I believe one of your chants, I recall hearing, when we fight, we win. Well, the coronavirus pandemic is a fight. And, now we have these tools, and I really want to be a part of the solution. I want to continue to be a part of the solution. I spent the last, 9.5 months on the front line, and I've seen the devastation, the destruction, and at the beginning, it seemed like there was no end in sight. And finally, that's changed. And it all changed a couple of weeks ago when the FDA began conversations around emergency use authorization for these vaccines. And, I know that we can't change the past, but we have to acknowledge it. And I'm really grateful for the opportunity just to come and have an open and honest dialogue about what we know about the vaccine, what the trials were about, acknowledge what has been done to prevent, some of the atrocities that happened in the past. We know that the coronavirus does not discriminate, that anyone can be affected. It doesn't matter your race, ethnicity, your job title, your gender, your age. But, our jobs as healthcare providers and essential workers give us higher rates of exposure to the virus. And so this is an important conversation. And again, I'm just glad to be a part of it. And thank you for the invitation.
Thank you. Thank you again, Dr. Prendergast, and we're going to get some more from you in just a minute or two here, and we'll have an opportunity. We'll be asking you a few questions. So thank you for joining us. We are also joined at this time by Dr. Amal Tokars, who is currently serving as the Assistant Director at the Illinois Department of Public Health, Masters of Science in the area of systems therapies in the clinical setting. Her doctoral work emphasized her love of organizational learning, social movement, and research methods, as well as a cognate in anthropology. The Illinois Department of Public Health is responsible, as the name suggests, for overseeing the public health of the folks in Illinois. And she works very closely with Director Dr. Ezike, but Dr. Tokars is with us, and with the Illinois Department of Public Health can give us a perspective on where things are with the vaccine and COVID in general. So I'd like to invite and welcome to speak Dr. Tokars. Thank you for being with us, Dr. Tokars. We appreciate you.
Thank you so much for having me. Can you hear me?
Yes, we can hear you very well.
Okay,
Thank you.
Beautiful. Well, there are so many important things to say, and I know that your time is limited. So a few things that I want to say. First of all, everything that we do, we want to think through a lens of equity. Just as everything we do, we want to think through a lens of ethics and ethos. We want to do the same thing and think about equity. So to give you a backdrop, you may know this, but I want you to know that in the spring, when we were first hit very hard by this pandemic, and we're just reeling from it, I want to tell you a little bit about who was most affected in terms of cases. Racially, our Latino group was most affected amongst all of us. Were most affected by sickness of this virus. And the age group that was most affected by sickness, I think you know, were elders, often living in long-term care. But the death rate that we saw in the spring was most likely to be borne at that time by Black persons. In relation to the rest of us, those were the persons that bore death the most in the spring. And the age that was most likely to bear the death were, again, elders, and often in long-term care. Now that we are in the fall, those that are most likely to have the adverse outcome of death happen to be Caucasian, and still that age group that is most burdened by death are elders. So you can see that this virus, as Dr. Prendergast has just said, really knows no bounds, just needs another person to attach to, and another person is just looking for another host and another host, and this virus will take any host that it can. But elders have certainly been consistently suffering through this from the beginning until now. I want to mention to you that during this time in which we are able to begin the vaccine rollout, and for many months to come while this is being rolled out, we will need to continue to take the public health precautions of masking and social distancing. And in this time of vulnerable metrics, meaning there's a lot of spread going on still right now, even though we're starting to see some numbers stabilize, we need to also be careful with our movement out in the community. So I wanted to just mention those things to you because the vaccine coming does not take those precautions automatically away. This winter will be a winter where we have to take great care. So this vaccine, I want to let you know, is administered in two parts, very much like the vaccine that we administered during H1N1 several years ago, that is administered in 2 parts. So whatever vaccine someone takes, whatever brand they happen to receive, they will receive the second dose of that same brand. There won't be a mix and match of that. And it will be 21 to 28 days later, depending on that brand. There have been very good questions about vaccine, about what is in the vaccine, like does it contain the fetus of babies, because many people don't want to take the fetus of a baby in a vaccine. Does it have mercury in it? People have asked that question. That's a very legitimate question. And is it a live vaccine? Now, there's nothing wrong with a live vaccine. Many vaccines need to be live, but I want you to know that this vaccine carries no fetus of a baby. This vaccine has no mercury in it, and this vaccine is not a live vaccine. The side effects of this vaccine, there are normal side effects that will be common, and these are described as flu-like symptoms that will pass from the individual between 1 and 3 days. They will dissipate. The person will not, in fact, contract COVID from the vaccine, nor can a person, let's just say that I get the vaccine and I get a headache and I have a little bit of an upset stomach. Neither do I have COVID, nor can I transmit COVID from that. But those are normal side effects. Not everybody will get those side effects, but they will be common, and they are short-term. Individuals that have immunocompromised conditions, certain ones in particular, if they have had an organ transplant, will be people that at some point will be prioritized for the vaccine because they will need it more than others. Also, people with type 2 diabetes at some point will also receive priority down the road. Right now, we're on healthcare workers and the precious peoples that are living in long-term care. But eventually, some of those conditions will give those individuals some priority to get it just a little bit earlier because they will need it more. In terms of reactions to medicines, you should consult your physician about any medicines that you're taking. There shouldn't be any issue with just general multivitamins that people are taking. But if you have had any history of allergic reaction to any vaccine or anyone in your close family, that you really want to talk to your healthcare provider about now. And that is true of any vaccine, whether it's flu vaccine. That is always the instruction that if you have had any history of allergic reaction or anybody in your family has 2 vaccines, then to discuss this with your healthcare physician and let them help you think that through. Now, if I know that I might be short on time, so there's one more thing that I want to say to you. Why is it a wonderful opportunity for you to receive this vaccine? First, the people that you serve in long-term care, these are the most vulnerable people in our society. They have been dying the most all along the way, and it's a very hard time of life. And we are all going to be elders. And I want us to think about the circumstances that people come to when they're living in long-term care. Most people would not choose it, and most of us would not choose it. And so it is an opportunity to really protect those persons when we protect ourselves. Secondly, you create a much safer and higher quality work environment for yourselves because you will have herding strategy, meaning that if virtually all of you are vaccinated in your workplace, you will not have the same worry that you do now of catching coronavirus from one another, which has happened all along through the pandemic. And third, you will be helping your family and even community members that you have never seen before, because your vaccination will help protect your family because you begin to create herding in your home. And you will, for each person that is vaccinated, they are protecting other community members that they have never met before by not transmitting a virus that they don't even know that they have. So this is a beautiful way to pay it forward, especially during this time of year. Now, I want to stop for a moment because I'm sure that others have to speak, and I know there will be questions as well.
Thank you, Dr. Tokars. That was very helpful information. And I know that time is small here. And I hope our hope here with this conversation is that it will spark an ongoing conversation with members of our union. We know that we can't answer everything right now today, but this is our first attempt at beginning to address the vaccine. And I think the information that you provided so far, Dr. Tokars, is a nice, helpful way to start. And as we move on here today, and even beyond today, we hope that we'll be able to come back and get into some of the meat of more of the questions that folks might have. So again, thank you for joining us and with what you've offered us so far. I'd like to bring back Dr. Prendergast, if I could, for a minute. I know that you and I have talked about this before, Dr. Prendergast, and it is, and you alluded to it in your opening remarks, and it is the sort of the historical concerns that many Black and Brown communities have had around vaccinations in general. The history in this country has been problematic in some ways regarding vaccines. And so I think it's important that we first acknowledge that. But then if you could talk a little bit about what is it about this particular vaccine that gives you confidence, and what makes it different from some of the really bad history that so many of us are aware of.
Okay, yes, that's a great question, and definitely one that has to be addressed before we can have a real honest, open discussion about the vaccine. And so, let's be honest, the historical distrust for vaccinations among communities of color is well-founded, right? So we are all unfortunately aware of the atrocities that happened with the Tuskegee men and the syphilis and the medical experimentation that has unfortunately been a part of the history of medicine. And but we know that in this case, as I mentioned, understanding that was a reality of that time, there are a lot of safeguards that have been put into place, but it's not just more about the safeguards to prevent those kind of that kind of medical experimentation from happening, but you have to really look at the trial itself and to see how there was a deliberate effort to make sure that there was a lot of diversity, all individuals were represented in the trial, and to not in just in a meaningful way. And the detail that went into setting up the trial, and I'll just share a couple of points about the trial. So, and we'll just first start with the Pfizer trial, Pfizer vaccine, I should say. There were about almost 40,000 individuals participated in that trial. 21,000 received the vaccine and 21,000 received a placebo or a saline injection. And within that, the makeup of the demographics of the trial participants, there were 80% Caucasian, there was 10% African American, 20% Hispanic Latinx, and almost like 4% Asian, and less than 1% so it was about doing the numbers, yes. So but in any case, you see that there was a lot of diversity in the patient population. And in the Moderna trial, which was predominantly US based, and I should mention with the Pfizer trial that it was multinational. They had the trial was conducted in Argentina, Brazil, South Africa, as well as United States. And the Moderna trial was here in predominantly in the United States. Actually, my institution was one of the sites that participated. And again, you had that same intentional diversity. And in the Moderna trial, they actually went a step further, and they included not only individuals who were from diverse backgrounds, but they looked at, 25% of the sample had to, the participants were healthcare workers. 82% of them were individuals who had occupational risk that would put them at a greater risk for developing COVID. They had 40% of them had past medical histories that would have put them at a higher risk. And so there was an intentionality about the design of this trial that actually makes me more confident in the results, because it included a large percentage of communities of color. And, I would love to talk about the numbers. I mean, they were just very, very impressive. But, again, that's how that at just the baseline gives me more confidence in the results, because we were included and they included a large representation.
Dr. Prendergast, can you just explain? I think one of the perceptions that people have is that they only developed the vaccine in like the last 6 or 7 or 8 months, when in fact they've been working on coronavirus vaccines for close to 20 years. Can you talk a little bit about that?
Yes, and that is actually key, because I know this is not, although it may seem as it is, but it is not, this is not a political issue. It's been played out. And I think that's kind of tainted some of the amazing work that came forth with this vaccine. But the corona vaccine is something that is quite novel. I mean, they've been working, as you mentioned, on messenger RNA vaccines for a long time. And so what's different about this vaccine that I think is important to understand, traditionally when vaccines are developed, they use a weakened version of the virus. And so there's no, the corona vaccine is not a live vaccine, a live virus. Essentially what it does, it takes, and I think everyone is familiar with the coronavirus picture, and you see those projections all across the schematic, the actual virus, and those actually represent a spike protein. And so what this vaccine essentially does, it takes a footprint, or scientists have been able to develop a picture or a copy of that spike protein, and the vaccine essentially tricks the body into believing that this is actually the virus, and it's an identical replica. And so there's no way that someone can contract the coronavirus from the vaccine, because it's not the coronavirus, it's a lookalike. And people may say, well, is it effective? Well, yes, absolutely, it's very effective. Just to give a few of the numbers, it was in the about 2,000 African Americans got the vaccine, and there were 0 COVID infections. 5,000 plus Hispanic Latinx individuals received the vaccine, and there were no coronavirus cases. Of the 21,000 people that received the coronavirus vaccine in the trial, there were 8 individuals that developed coronavirus. None of them needed to be hospitalized, and there were no deaths. In the group that did not receive the vaccine, that received the placebo, there were 162 coronavirus cases, and there were 2 hospitalizations and several deaths. And so those numbers are beyond impressive, right? And so the fact that you cannot get the virus, and that it actually stimulates enough of an immune response to protect people, I think it is definitely something that we should, listen to. And I would highly encourage everyone to get the vaccine. As was shared by Dr. Tokars, this is really about, it's protection for yourself, it's protection for your family, it's protection for people that you don't even know. We know that the only way for us to get back to a normal life that we used to all enjoy, it's going to be a new normal thing. Some things will change. Is for us to have at least 70% of the global population to be vaccinated or develop immunity, right? And there's only two ways that could happen, either through vaccination or through, unfortunately, through, death. And we don't want the latter. And so, the availability of a vaccine won't protect us, but getting the vaccine will protect us. So this is just the first step, is just, it's here. So now let's talk about it and get, find out what are the concerns, what are the questions, and how can we address them. I am proud to say that I was so excited to get my vaccine. I had zero side effects. I was, my arm felt a little sore. It just felt as if I got a tetanus shot, but it didn't last. How
long ago did you get it, Dr. Prendergast?
I was there Friday morning at 9 a.m. And, I can't really even put into words how relieved I felt, because it's been, I've been in the ER the whole time, and there's always, there's always a risk, like, okay, is this the day that my PPE fails me, or, and so just to know that, what, hope has arrived. And I know it may sound cliches, but it's true, right? And I'm kind of nerdy, and I read the entire report, and, and so I can say that it's safe. I would never advise anything that I wouldn't do for myself. And I want to hear your questions. So so let's continue to talk about it.
All right. Thank you, Dr. Prendergast. For those who are just joining us, we're being joined by Dr. Prendergast, Associate Dean of the University of Illinois College of Medicine, ER physician, who's has honored us here with some important information. Dr. Tokars from Illinois Department of Public Health, I believe she may be gone though, but she was here. I'd like at this point though to bring in a couple of our members. First, I'd invite Kendra Bush, who is a home care provider in Indiana, who I'd like to have her talk a little bit about. I'd like to have you're right here, Kendra. I'd like for you to talk a little bit about your experience, because you were a part of the vaccine trial program in Indiana. Yes, and so can you tell us a little bit about your experience?
Well, I went on a trial because I talked to my doctor about it when they contacted me, and I asked her what she thought about it, and she told me that was a good thing to do. So when I went on the trial, and I got the Johnson & Johnson vaccine, and they administered it in me. And I sat there for a while to see how it worked. Everything went fine. Every Monday and Thursday, I check in on my phone and let them know how I'm doing. So I'll be on the trial for a year. And everything is going great. And I would recommend anyone to do that, because that's good for us, so they can know when they're doing a vaccine, how it will work on African Americans. And it was not a lot of African Americans coming to the trial, so they had to close it down. They extended it for another week, but they had to close it down because it wasn't that many of us coming. And that's why they put it out there for us to do the trial. So with that said, that's all I have to say. Thank you. Greg,
I'm here. I'm talking, and I'm still on mute. I want to thank you, Kendra, for that, and we'll have you back in a second to ask some questions. We're going to go here until about 6, but I wanted to tell folks who are on or listening in, this is the first of a number of conversations that we're going to have as a union with our members about COVID and the vaccine. We know that folks have a lot of questions, but we certainly wanted to start the conversation with experts. We know there's a lot of information out there. People have strong feelings about it, but we thought it was important to just start and have some professional opinions on it. And then hopefully with more information, people will feel more comfortable about the decisions that they make for themselves, because we can't make decisions for you. We can only help you get the right information and begin to try to protect you at work. So this is an ongoing conversation. We're not going to be able to answer every question, but hopefully this will get the juices going for folks. Okay, and so with that, I'd like to invite our next speaker, who is another one of our amazing members, Mary Beth Lindsey. She's one of our active HCII union members and is a proud home care worker. She cares for her daughter, Jessica, who's ventilator dependent quadriplegic. And she has really taken on really leading throughout home care. And we couldn't be more proud of the work that she's doing with the union. And currently, you sit, Mary Beth, on the Biden home care task force. Is that right? The incoming president. And if you could talk a little bit about that, his COVID task force.
Absolutely. Last week, as a matter of fact, thank you, by the way, thank you, President Kelly. It's an honor to serve you and the other brothers and sisters of our union. We have an awesome union. Last week, I got the opportunity to work with a group of SEIU people who were talking to the Biden Transition COVID Advisory Panel on Healthcare Workforce Issues during the pandemic. And our job was to come up with key talking points for them, to let them know, to educate them and remind what was important to us. Just a few weeks before that, I was on the action team for Illinois and got to talk to our Senator Dick Durbin's office for Lobby Day. I've been on a national panel talking about what the Biden healthcare plan would be for us in the future and what it means for me in the future. Thank you, President Kelly.
Thank you. So we've gotten a whole bunch of questions from members, and I'll ask a question, and then Mary Beth and Kendra, if you can ask a question or two that you see. So Dr. Prendergast, if you don't mind, I'd like to ask a couple of questions. Someone asked about the difference between Moderna and the Pfizer. What's the difference between the two vaccines?
Okay, so basically they're both the same type of vehicle. They're both mRNA vaccines. So they both use that footprint, that look alike. So they're similar in that way. The Pfizer vaccine was, again, trialed in several nations, and it requires ultra cold storage. And so because of that, you may have seen that the first shipment of Pfizer vaccines went to probably large hospital centers that have that capability. Now, the Pfizer vaccine will need both of them are 2 doses, and they both, the Pfizer vaccine needs to be administered every the second dose in 21 days. The Moderna is 28 days. The Moderna vaccine is a US product in that it was tested primarily in the United States, but it's the mRNA vaccine, and that vaccine, the second dosing is 28 days apart. was similar across both the demographic mix. So they really worked hard to make sure that it was a truly as representative a sample as or in participants as possible. The Moderna vaccine does not need any ultra cold storage, and so it could be just stored in, you know, a regular freezer type environment. And so that is actually going to expand the availability. So the Moderna vaccine will most likely go to rural hospitals, community centers where they don't require these ultra cold storage. So that's encouraging, because that means that, you know, there should be no reason why anyone shouldn't be able to get the vaccine. They're not going to be just limited to certain areas. So that's the primary difference, is really in the storage temperature, but across the board, they had similar efficacy and effectiveness, and you know, even the side effect profile, which, you know, again, you know, one that there was really no significant side effects, right? So flu-like, you know, illness, but that's more of a immune response and not necessarily a side effect. But so yeah, so no, they're pretty similar.
Can you talk a little bit more about the side effects? Is another thing I know you and I have talked about. I've come to refer to it more now as adverse reactions, because that's how you've told me to talk about it, as opposed to side effects. But can you talk a little bit about that? And because I feel like it's important that people know, yes, there are things that happen as a result of it, like the flu-like symptoms, but those are actually good things as opposed to like bad things. Can you talk about that a little bit?
Absolutely. So with the vaccine, remember now that when we give a vaccine, we want to stimulate the body to generate some kind of immune response. You really want to teach the body how to fight against the virus should it attack your body, right? So the vaccine does that. That's what it trains your body to do. So when you get these, you know, if you have a reaction, and when I say reaction, you have an immune response, that just means that the vaccine is doing its job, right? So it's not necessarily a side effect to have, you know, feel a little fatigued, or, you know, that is what we would expect with them, you know, as part of the immune response. Now, everyone is different, and not everyone will experience that, but these are not, you know, this does not mean that you've gotten COVID, as Dr. Tokars mentioned. This is what we would expect, because we are essentially, you know, asking your body to, okay, you know, we want them to generate a response against it. Now, there are certain things that would be considered a side effect, you know, or things that you would be concerned about. So typically, just so that everybody would know what the profile looks like. So what can be expected and is not necessarily a side effect is if you can have, you know, some tenderness at the site of the injection. You may even have a little bit of redness, but it's not anything. It should not be hot. You should not spike a high fever. You can have, you know, you can feel a little like you coming down with a cold, but it should be something that is very short-lived, right? It should not, you know, you shouldn't have days of this. This should be more like hours, right? And then you just then it passes quickly, because it's just you're stimulating your body's immune response.
Awesome. Okay, now, Mary Beth or Kendra, before I go back into the question and answer, either of you have questions for Dr. Prendergast right now?
I have one. Can you tell us a little bit about the actual vaccine and how is it administered?
Yeah, so the vaccine, so they're multi-dose vials. And so with the Pfizer vaccine, I think there's 6 doses in the vial. And it's typically they're given in a deltoid. And it takes probably less than a couple of minutes to get the vaccine. And, you know, because you know, if you have a history of severe allergic reactions or anaphylaxis, then you probably shouldn't get the vaccine. because, or you should make sure that you're in a location where you can receive treatment should you develop a severe allergic reaction. It's rare, but of course, with any vaccine, this is something that can happen. And so most hospital or centers that are administering a vaccine are aware of this, and they have, adequate personnel and available to assist. I can say that at my institution, we're probably have maybe administered almost a little under 1,000 vaccines, and we've not had, any severe allergic reactions. And so the vaccine it's a very simple, quick, easy, painless procedure. You're watched for about 15 minutes afterwards, just to make sure that there is no, don't develop any reactions, but it's quick, easy, and painless.
Great, great. I'll come to you in a second, Mary Beth. Related to that, someone asked about Bell's palsy. I know it was a story in the news. I know it's been going around on social media that the vaccine causes Bell's palsy. Can you speak to that a little bit?
Yeah, so that would be considered a adverse reaction, and it's rare, but it can happen, and it has happened. But that, it actually didn't happen during the trial. So this is, we can't predict for everything, but again, was it really caused by the vaccine? We don't, you don't know. But yeah, it can happen, and I'm told that it has happened. I've not seen it, but that is a possibility for sure. Absolutely.
So, Mary Beth, do you have a question for Dr. Prendergast?
Sorry, I had to unmute. Hi, Dr. Prendergast. Thank you so much. I was wondering what you could tell me. What were some of the challenges discovered during the COVID-19 trials? And how were the trials administered?
Yeah, so I think one of Kendra, Ms. Bush just mentioned it. One of the biggest challenges was getting people to participate in the trial. It wasn't as easy to get individuals of color to participate because of because of the history and the distrust. And so, I know that there had to be a lot of intentionality around getting a very diverse, participant pool. And that it was challenging. But then once, I think I belong to the National Medical Association. And so it was something that, seeking out opportunities like this or forums where we can actually just talk to individuals such as yourself and organizations, and just really hear out some of the concerns. I think there was a lot of distrust, and that proved to be the actual biggest challenge, because if you look at the data from the trials, they were actually very there weren't any real major issues. Now we know that the trial is, participants are continued to be monitored, but I think it's incredible that we could have had over 40,000 individuals participate in a trial, and to say that there was no hospitalizations and no deaths. And as Ms. Bush mentioned, they follow these participants in trials very closely, right? Because you have to, right? It's a trial, and you have to know every single thing, right? Nothing is too minimal, nothing is too insignificant to be mentioned. And so the fact that after all of this tremendous amount of people that participated, that there were no deaths, there were no hospitalizations, when we've seen how many people have died from this vaccine, from this virus, this vaccine is just incredible that we have something like this to offer, given the amount of destruction and death that we've seen in our communities. So that was the
Yeah.
biggest challenge, was getting us to the table. But, we did get, what I think, I don't think we've ever had a study where 34%, and in the Moderna trial, it was 34% of the participants were from were individuals of color. And so that's incredible. We've never had that kind of intentionality around such a major vaccine trial as this.
Can I ask one more question regarding that, and especially regarding the distrust? What do you say to people who say the process was done way too quick?
Well, I think that, when you look at the number of lives that were lost, that, we had to do something, and we had to do something fast. And so, thankfully that this is, and I think Greg mentioned this, they've been working on, this type of vaccine, and when I say this type, I'm talking about a messenger RNA. And so the lead scientist, Dr. Corbett, who's an African-American woman at the NIH, who's the lead scientist. And this is something that they've been, working on for a long time. So it was really, the sense of urgency, around the number of lives that were being lost. And this is a global pandemic. And the fact that there was already something in the pipeline. And then, we just had really, the government put a lot of resources behind, trying to get answers and try to find something, because quite honestly, we still have to, wear our masks, social distance, and, wash our hands, but those are still, they're still, just a basic layer of protection, right? So without a vaccine, we'd still be in this, and we'd be in it for a very long time. So there was an urgency, and I know it seems fast, but you know what? The data is there and it's available, right? And it's, it's transparent. So I think that really is comforting and helps to justify the speed at which it was brought forward.
And the last of what I want to ask you, I know you mentioned that a copy of a spike protein that was on the surface of the COVID vaccine was used. What about new strains? And is this going to prevent us from getting all COVID, or what about the new strain that just came out of England?
Right. So yeah. So the thing about it is, and this is the really cool thing about the spike protein is the base. So even though the virus can mutate, they can change certain appearances, but the base stays the same, right? So it doesn't matter. The vaccine should be, because it's constructed around the base, the core of the coronavirus. Even though it may mutate, it doesn't change the base. The fundamentals are there. And so the vaccine there's no reason for us to suspect that the vaccine won't be effective against these strains, right? Because the core elements are still there. And so, and we will see, but I know that just based on how they've constructed it, because at the time these vaccines were under development, we already know that the virus has mutated. The cases that we're seeing now are a lot different than the cases we saw at the beginning of it. Coronavirus is far more contagious now than it seemed to be in the spring, right? So with that though, we're not seeing as many, we're not seeing as many adverse or severe outcomes, right? So we're seeing a lot more people, but they're not as sick. And so that's, again, the virus, and we know that the coronaviruses are not necessarily stable viruses. They can mutate quite easily. So that's kind of to be expected. And the vaccine, by all accounts, should still be effective against these strains.
Thank you.
Excellent questions, man, Beth. So what I wanted to get to very quickly is, what is the union doing? So as you all know, the release of the vaccine is a new event. And we have been working really hard, whether you work in a hospital, whether you work in nursing home, home care, child care, to engage employers around the vaccine. We think that for those of you all who work in hospitals and nursing homes, you all have an experience in dealing with the flu vaccine and how that's worked. And so we're trying to make sure that there are processes put in place so that workers who have concerns can continue to raise them with the various employers. We think that in order to really make people feel comfortable about the vaccine, some people may never feel comfortable about the vaccine, just like we know that many of our members have never become comfortable with the flu vaccine. We know that. And so we want to make sure that workers have a voice in vaccination, have all of your questions answered to the best of your ability, because we won't have every answer on all of this, right? But we want to make sure that employers are supporting workers who are in need of vaccination if they want it, if choose to. We also want to make sure that people have paid time off. You heard Dr. Prendergast mention that adverse or side effects are pretty rare. But if folks wind up taking the vaccine, we want to make sure that people have paid time off if needed. Again, it's a rare thing, but we want to make sure that if in fact folks are having to take it, that they have paid time off. We continue to make our argument that workers who are working in the midst of this pandemic should get pandemic pay. We believe, obviously, that this is not going away, and even with the vaccine, it won't go away right away. And so we believe that workers who continue to put themselves at risk and on the line every day should be entitled to pandemic pay. And we also believe, and we continue to fight for, higher base rates of pay for these healthcare jobs, because it's not even because of just COVID, but healthcare workers who work in nursing homes, home care, and childcare providers, as well as hospital workers, deserve higher base rates. And that's our fundamental job. We're going to continue to fight for that. Again, continue to fight for sufficient time off for folks who may contract COVID, and then more PPE and any other resources that folks need. And then most important of all, we want to make sure that workers, again, whether you're in home care, whether you're in childcare, whether you work in nursing homes or a hospital, that you have a voice on the job. And that even as COVID hopefully begins to peter itself out in the coming months, that the voice of workers are central to everything that happens going forward. None of us have all the answers to where this thing is going, right? But we do know that when workers who work in all of these types of facilities have their voices heard, that things work better for everyone. And so we're going to continue this conversation around COVID and vaccinations beyond today. We didn't get to answer every question, but I think we started a conversation with everyone to really sort of dig into what's going to be around for a while, even with the vaccine. So I want to thank everybody for joining us. And before I close us out, I want to ask Dr. Prendergast if you have sort of any final words of wisdom that you'd like to share with us.
Yes, I would. Yeah. Oh, sorry. I would just encourage everyone to, keep an open mind about the vaccine. I know there are a lot of, there's a lot of information out there. There is historically, we may have had a reason to be distrustful, but that's not the case with the vaccine here. It has demonstrated a very good efficiency or effectiveness in individuals of color. I think, it's been reported, and it's a fact that we have been disproportionately affected by the coronavirus in terms of suffering most of the adverse outcomes. And so this is something that we need to do. I believe that knowledge is power. And I was very grateful for the opportunity to come in and speak to you guys. I feel like we're all in this together. I do strongly believe I am my brother and my sister's keeper. And so I would encourage everyone to, when the vaccine becomes available, to really consider taking it. In the meantime, continue to do those things that are helping us to slow the transmission, but understand that just because we have the vaccine available, it's not going to help us unless we get vaccinated. And so I hope that that there's been something that I said that may have cleared some confusion up. But, you know, I would love to empower everyone on this call to take the message forward and talk to your friends and family and anyone else about the vaccine and dispel any myths, because it's, you know, that's the only way that we will get out of this. And I couldn't say this 6 months ago, but I can say it now, that if we all align around, you know, understanding that this is the best thing that we could do to get our lives back to normal, I think we will get there sooner rather than later. So again, thank you so much for the opportunity to come and speak, and I'd love to come back. So that was my invitation to come back.
Great. We would love to have you come back. And I know you mentioned one of your colleagues who is bilingual, is willing to come on as well. That would be great also. Yeah. Now, if I could just, for one thing, I would be remiss if I didn't say, number of questions that were asked around people's own individual health situation. And I want to give you the opportunity to say that folks should consult with their physicians as well, right? That because everybody's health makeup is different and condition is what it is. And so to the extent that folks can, just urging people, if they have questions, to consult their own physician, right?
Absolutely, absolutely, because communication is key, right? And so definitely reach out. I would, you know, everyone's situation is different, you know, and I believe that is always, you know, great advice. You know, seek out your, you know, primary care doctor. And if you don't have one, you know, seek out to get find a doctor. There's, you know, there are a lot of resources, and, you know, as much as we can connect individuals to a resource, but definitely talk to your doctor. You know, find out if there's any specifics or sensitivities around your specific case that would alter your decision making. But, you know, definitely thank you for the reminder to share that, Greg. Yes.
I knew you'd want to say that. Mary Beth?
Greg?
Yes.
When they go to get the vaccine, do they have to have their ID with them to identify them?
Was a question people asked me.
Yeah, well, so there is a so the way, because this is the way they're rolling out the vaccine, and because it's a 2-dose vaccine, and you have to get the same type of vaccine that you got initially, right? So it would be a mistake to give someone who got the Pfizer vaccine, the Moderna vaccine, on their return. So they do need to take your name. I don't know that they, you know, this is tracked and is mostly for ensuring that people are getting the right second dose, right? So I'm not aware that they're taking IDs, but they do have to, you know, enter it into a database, right? So we know this person got this vaccine. And so, but I you know, I'm not necessarily, they didn't ask for ID, they asked, I mean, you know, my name, but, you know, so I can't speak for every center and how they're going to do it, but it's not a requirement. But they do need to get your name and information so that they can contact you and for tracking purposes, but not necessarily. I don't think they would turn someone away who didn't have an ID. But, you know, every system is different. But that's not the intent. To really, they don't want to. We really want to encourage everyone to get the vaccine, and we don't want to make it hard for people. So I know that the mayor has set up some really put forth some recommendation, or IDPH has put forth some recommendations about, what information can be collected from individuals. But I think, by far, it's mostly for ensuring that people are getting the right second dose.
All right.
Okay, thank
Oh,
you.
and there should be one thing I know we're over time, but there's one thing that I have to share. If you have had COVID and you've had more than just a mild case, then chances are you have some antibodies, and you have to wait at least 3 months before you can get the vaccine. So we've had people who have had COVID come to get the vaccine. I mean, they're healthcare workers, but if they've had the coronavirus, they have to wait 3 months before they can get another. Now, and especially if you had coronavirus and you were an asymptomatic individual, and that you just found out on a test and you never had any symptoms, chances are your body did not mount an adequate response, and so you probably should get the vaccine.
Awesome. All right. Well, thank you. What a complicated subject, and so much more information to share, and we're going to do our job, our best job of providing folks with as much information as we can. This is the first of what will be a number of attempts to communicate with members about not just COVID, but also the vaccine. And we couldn't have started out with a better person than Dr. Prendergast. Thank you again, Dr. Prendergast, for being with us, and hopefully we'll get you back on later.
Yes, I'm coming back with my colleague, Dr. Del Rio. So we'll continue the conversation.
Awesome. Mary Beth, Kendra, anything, last words for us?
No, I just want all my home care workers and child care workers, nursing home workers to take the vaccine, and it's very beneficial for them and their family and their coworkers.
I too want to see us all healthy and happy for the new year. So please get vaccinated and keep your masks on.
That's right. Again, thank you, everyone. More conversation to come, more information to come. I thank everyone for taking the time to listen. And again, you heard it already. Take care of yourselves. I look forward to being able to see everyone in person again real soon. All right.
Bye.
Happy holidays, everyone. Happy holidays.
Happy holidays.
Happy holidays.
Bye-bye now.